to tell you how we made a very inexpensive, low fidelity circumcision model. And this is mostly used to train the new interns when they come in for their intern boot camp at our institution. So first of all, we started with any type of a tray. We have these very inexpensive cardboard food trays, or we also figured out that with each vaginal delivery set, a very thin plastic tray. Once you have your tray, you could even use a cafeteria tray if you wanted to, but once you have it, create an outline, cut it out on cardboard so you can reuse it. You'll use some type of a permanent marker to then draw the outline on your tray. And then once you have that, you want to get a hot glue gun and glue both a infant bottle nipple as well as the lid onto your tray such that it will stay permanently. Other things that we use for this low fidelity model are to gather any gloves that are left over. These are surgical gloves, usually size 5.5 or 6 work best. We then use the glove and we'll cut off one of the fingertips like this. Take the nipple out of the lid, kind of stretch it over the indentations. Once you get it stretched over, you want to place it back into the tray. Pull it up, such, and then cut off the tip to create the simulated foreskin. After that, we obtained a circumcision tray from our labor and delivery. It contains all the items that we need. Today we're going to demonstrate on a Gomco clamp. You can also use a Mogan clamp for this as well. In addition, because we wanted to make sure that all the sights and sounds are folded into the memory of the student, we also got the sweeties that we use as part of our anesthetic during this procedure for the infants. And we opened it up and actually had all the students actually taste the sweeties so they would know exactly what it is. So each table is set up with the circumcision tray as well as the infant foreskin as shown in the picture now. We will now demonstrate the use of the circumcision model using the Mogan clamp. The learner initially anesthetizes the penis using a dorsal penal block by simulating given the 1% lidocaine 0.5 cc's on both sides at both 10 and 2 o'clock. Now, after sterile preparation, sterile towels will be placed over the simulation model. All steps of the simulation are performed in sequence. The surgical instruments are prepared. The foreskin is then grasped with the hemostat at both 10 o'clock and 2 o'clock. Following this, simulation is performed using either another hemostat or a blunt probe to break down any adhesions prior to then crushing the foreskin at 12 o'clock to create an incision. Shown here, the foreskin is then crushed, and then the blunt end of scissors is inserted into the foreskin and an incision is made at 12 o'clock. We will now demonstrate the use of the Mogan clamp on this circumcision model. The Mogan clamp is then placed over the foreskin, leaving the hemostats in place, being sure that the apex of the incision is above the Mogan clamp. Another hemostat can then be used to be sure that the apex is above. Once the Mogan clamp is secured, a scalpel is then used to cut the simulated foreskin The Mogan clamp can then be removed, and the adhesions formed from the Mogan clamp are then broken down, and just as you would in real life, the foreskin is inspected for completeness of the circumcision. And now we're going to demonstrate using a Gomco clamp. Incidentally, as the instructor, you can have extra bottles, nipples already lined up with the tip cut off and covering the ridges so that you can readily have the student repeat the entire process. So we have already draped and anesthetized the simulated foreskin. We will now use the hemostats at 10 o'clock and 12 o'clock to grasp the foreskin. We will simulate reducing any adhesions using either the hemostat or the large probe. Then we will crush the tissue at approximately 12 o'clock using a third hemostat, and then always being sure that we keep the tips up on our scissors. We will place that inside the foreskin and incise the foreskin, and then we will use the Gomco bell to place it inside over the penis, removing our hemostats, place that inside over the penis. And at our institution, we will use a safety pin then to be able to help us maneuver that foreskin above the Gomco clamp. We are using a 1.3 Gomco in this simulation model, as it is the most easiest to use over the bottle nipples. Sometimes you have to again use another hemostat to be sure that all of the foreskin that you want is above the tissue, also being sure that the apex of the incision is well above the clamp. Place the clamp onto the simulated penis, clamp it down, and then you will just use a scalpel just as you would using the Mogan clamp to cut the excess foreskin away. On this simulation model, your scalpel clamps or your scalpel blades do become dull quite quickly, so you may need to replace those. Many institutions will use a disposable scalpels, and you want to be sure that that occurs as well. The foreskin is removed, the clamp is then released, and the Gomco bell is then removed as well, and the circumcision has been completed.
Have fun. Thanks for watching. The